The State Region Conference approves the opening of the Mediterranean Institute for Transplantation and High Specialization Therapies. Ismett is created for Sicilian patients as an experimental management partnership between the region of Sicily and the University of Pittsburgh Medical Center. The first group of doctors and nurses of Ismett traveled to UPMC in Pittsburgh for a period of training. The first ever liver transplant in Sicily is performed at Ismett in the temporary premises at Scientifico hospital in Palermo. This marks the end of the so-called journeys of hope for Sicilian patients. Construction begins on the new hospital. Works are completed in 2004. The Renato Fiandaca Simulation Center is inaugurated. Dr. Gridelli performs the first lung transplant in the world on an HIV-positive patient. The first cell production laboratories in southern Italy are opened. Ismett is the first hospital in southern Italy to receive the Joint Commission International Accreditation for quality and safety of healthcare facilities. The 11,000th transplant is successfully performed. For the first time in the world, a liver lobe is pursued for purpose of transplant using minimally invasive robotic surgery. The Ministry of Health acknowledges Ismett as an IRCCS for treatment and research of end-stage organ failures. Ismett opens its first hybrid room in line with its mission of technological excellence. For the level of complexity, innovation and quality of its services, Ismett today is recognized as a center of excellence in the field of transplants and high specialization therapies. The complexity of its patients is reflected by an average DRG weight that has no equivalent in Italy. Ismett is part of the regional health system. Over a third of its patients arrive from other hospitals or are admitted in emergency. Innovation is evident in the state-of-the-art diagnostic and therapeutic techniques used for transplants, in the minimally invasive surgery, radiology, endoscopy and cardiology therapies, in the advanced systems of electronic medical record, telemedicine and business intelligence, designed to reduce the length of stay, boost the effectiveness and accuracy of care, and improve management efficiency. The home monitoring project, for example, allows patients to receive care while at home in the weeks following the transplant. This reduces the economic and social costs of hospitalization. For all these reasons and for the dedication of all healthcare providers for the patients and their family members, patients from all over the Mediterranean area and beyond turn to Ismett for treatment. The quality of the research conducted at Ismett gained its acknowledgement from the Italian Ministry of Health as Institute of Care and Scientific Research, a recognition awarded to selected Italian medical institution pursuing excellence in patient care through innovative and translational research. Ismett's strategic collaboration with the ReMed Foundation, involved in biomedical and biotechnology research projects, further enhances the transfer of innovative outcomes to the clinical practice. Ismett contributes to the professional growth of Sicily's regional health system through the dissemination of UPMC's know-how. Ismett hosts a simulation center with sophisticated simulators used to train doctors and surgeons. The goal is to always improve patient care, and Ismett constantly pursues this goal. Very soon, the doors to the new Heart Institute will open to better meet the needs of an increasing number of patients. Almost 2,000 transplants, over 300 from living donors and 200 on pediatric patients, dozens of scientific publications and awards. However, beyond these figures, most importantly, lies the dedication of our staff, that in the past 20 years has shown a constant commitment and professionalism to help improve the lives of our patients.